You also asked about what was a surprise.
Mhm.
I'm used to doing the kind of the basic lab tests and really nothing outside of that box. And I was really surprised about all the just learning all the lab panels that you guys do here. I've been meeting new patients. They're coming in for their first visit to establish care, and I'm kind of going through our lab panel testing, and I'm like, wow, there's you don't just check a TSH for thyroid function, you actually check the whole panel. And in previous positions, it's been a struggle with if they meet criteria in terms of having the diagnosis, why would you go after it and check it? So thyroid panels, the hormone testing, just being having more of a complete package of care here.
Hi, Lee Acey with HELPcare Clinic, and we're excited to welcome you to another episode of our Take Charge with HELPcare podcast. Along with my co-host Dan Hinman, I'm glad to welcome as our guest today and as our most recently joined nurse practitioner, Karen Popp. So Karen, welcome to Take Charge with HELPcare.
It's great to have you on the show today, Karen.
Thank you, Dan. It's good to be here.
Well, maybe you could just start by telling us a little bit about your history. Where did you grow up? Tell us a little bit about your education and anything you may like to share about your family.
Yeah, I grew up locally outside of a little town called Byron, Minnesota, which isn't too far from here. I grew up on a farm and youngest out of four, and so that instilled in me a good, a strong work ethic from a young age. And I pretty much have stayed locally. I did go up to the Twin Cities for college and left home and never thought I would return. Nursing's actually my second career. I was going to initially thought I was going to be a large animal veterinarian, and that I did get a bachelor degree in animal science and worked for a time for about 5 years, and actually wound up at the Minnesota Zoo and animals. And due to some budget cuts, that got cut short after about 5 years, and I thought, what could I do next with my life? And I have a strong family history of nursing. My mom was an RN and an aunt and a great aunt, so I thought that would be a pretty safe bet to go into, and I would never get bored. So 3 college degrees later, I wound up as a nurse practitioner. And I did move back home. Unfortunately, my parents became ill with Alzheimer's and Parkinson's disease, and I thought it was best to move back home, and it's actually worked out just as it should have been. I'm very grateful that I did that, and I was able to relocate and help them out in their final years and be present and step away from my career a little bit. But I did manage to kind of work through my college degrees during that time and in the face of adversity and trying to manage and balance life. It's all worked out well, and that's kind of how I wound up with wanting to focus more on the adult geriatric population, and I can really understand what it's like to be in that position with patients that are kind of struggling to for the role reversal.
I was going to ask, Karen, what lessons did you take from those years you were caring for your parents that now you're pulling into your medical practice?
You can't learn it in a book. Yeah, and that's what I've learned from a lot of my patients too, as they're struggling with different illnesses and diseases. Just to be present, and because you don't get to go back and relive those years, and just falling on your support systems and values. And I've learned a lot from it. It's hard to put it into words. And unfortunately, my siblings weren't there. They all lived out of state. So I had a lot of backseat drivers, and I can relate a lot to what patients, when they're placed in that position and they have to make like a lot of the medical and financial decisions, and they're trying to do the best thing possible with the options they have available and not knowing what their parents might have wanted, even though it was in writing for me. In terms of having a plan, you just never quite know if you're doing the right thing at the time. But it was an opportunity for me, and I was grateful to be in that position to help them. I wouldn't do it any differently.
Sounds like you learned a great deal of empathy through that whole process. And so, what made you become interested in the healthcare clinic model?
I knew about it, but I didn't quite know everything about it. And the whole direct primary care concept was new to me. And hearing patients since I've been in nursing, and especially as a nurse practitioner, every year they are faced with having having insurance, but not wanting to spend their deductible, and not it's kind of feel like it's turned into sick care in a way. They just want to come in when they're sick because they're kind of financially penalized for it otherwise. So hearing that, and every year it seems the struggle just worsens with increased costs, and yet we have our America, we have all these treatments and things, and yet we're still getting further and further behind. So kind of learning more about lifestyle medicine, even though we're taught it as a first line therapy in school, having that and then hearing the position of my patients, and then actually learning about the clinic through a mutual connection that Lee and I have really, it felt very aligned with my values. And also that it's a faith-based organization really helps which helps guide my internal compass, so to speak. So after coming down and shadowing for a day and interviewing and meeting all the clinicians, and just seeing how things worked, and that what really drew me though was the kind of thinking outside of the box, because I've been in organizations in the past where I've been kind of confined with their treatment options, and knowing that might not be the best thing for the patient, or they're not really wanting to do that kind of treatment. Just putting all those things together and coming back and reflecting on it, I felt that it was going to be a really good option for me, and I'd fit in well and be able to expand on my primary care skills and stay local.
Yeah, Dan, I'll just say it was a great connection, a mutual friend that Karen and I both had, and he got us introduced, and he said, Karen would be just a great addition. Just really shares your values in terms of your approach to things, and so he got us connected. We met, kind of talked through a little bit about what our system's all about, and that it's really about that, having time to have conversations with the patients, getting to know them, creating that sort of consistent relationship. And I think, Karen, that was really, kind of an appealing thing, and, as you said. And so we had her visit with us and spend time with each of our practitioners to really get to know and understand whether this was the right fit for her. We did this over a couple months where we were at the same time we were adding some new corporate members, adding some retail members. And so we kind of have to line it up to make sure we have the right number of practitioners for the right number of members and patients that we have. So it all just kind of came together really, really well. And that she was able to start in the first part of February and just give us the additional practitioner power that we needed, right at the right time.
So hiring Karen was a response to growth in the organization.
Yeah, it absolutely was. I mean, we had gotten connected with her probably in October, I think was when we first connected. And then it was over a couple months that we, sort of discussed whether this would be a good fit. And then once she decided that, it was first or for early part of November, because she had to give 3 months notice at her previous place of employment. But the fact that she's really situated in a great spot where she lives, kind of almost equally distant between the three clinics that we have between Rochester, Austin, and Albert Lee. A little farther from Albert Lee, but she's kind of settling into our Austin clinic right now as the main base in terms of where she's building those relationships and able to meet the needs there.
Yeah, sounds like a great match and the perfect timing. And so it's wonderful that all of this came together. It makes a big difference when you're comfortable in the workspace where you are.
What made you decide to go on to get the nurse practitioner certification and move into that role?
So as I said earlier, I have three college degrees additionally after I got my animal science bachelor's. So I moved kind of my way up. There's various levels of registered nurses and advanced practice, but I just got my hands dirty, right, so to speak. Did the associate's degree, got my RN or registered nurse, so I could start practicing. And I started out pretty broad in medical surgical, like a post-operative floor at a hospital, up in the Twin Cities, and it was a really good experience because it was mainly orthopedic, so it's more black. It's you kind of know what to expect on each post-operative day. So it was pretty good in terms of starting as a new graduate, and we were also able to do a lot of skills at this hospital, such as IVs, catheters, so like NG tubes, a number of things like that. And then I did transfer down when I came home to Mayo Clinic, And part of me, it's unhealthy to say, but I wanted to kind of immerse myself in school to not deal with, at the time, my parents' issues. And I thought, if I'm going to move back here, I'm going to just go all in. I worked nights. I worked 12-hour nights so that I could just get kind of my 3 shifts in a week and then go to school during the week days and then help my parents on all my other free time. Along the way, I got my RN, and then the gold standard for that is kind of getting a Bachelor of Science degree in nursing. So I did that. I did the 1 year track, and then they enticed us with, hey, there's a kind of a pathway into the nurse practitioner role, and I thought I would apply. And alongside of this, I was also working full time as an RN on a medical surgical floor, and I wanted to. While I was at Mayo Clinic, they were very big on education, so I thought I'm just going to keep learning, and I'm a lifelong learner. That fits in well with my values. And I got some specialties for woundostomy and continence nursing, so I could take care of those patients better. And then that allowed me to kind of work beyond the hospital. I went into clinical roles, outpatient, and then once I became a nurse practitioner, I left the health system at Rochester and went into the kind of because the residents, they get a lot of the fun with hogging all the surgeries, and I really wanted to get my hands dirty and get in the operating room and be a surgical first assist in orthopedics. And that led to other specialty areas. And then I got in more of the clinical side of things in the operating room primarily, and then pre and post-operative settings with those roles. But my work-life balance wasn't that great with non-elective surgical cases that come up emergently. So I eventually stepped back and went into a wound clinic. And then I went back and did more a service that wasn't offered when my parents needed it. I went into working at Twin Cities Physicians, and we got to that enabled me to go to long-term care, uh, nursing homes, skilled nursing care facilities, and assisted living facilities, and actually see the patient where they live. So I've worked in a lot of different settings, and that was a tremendous value because I wish my parents had that opportunity. So I know what it's like to have to try to get them to appointments and to be seen, and how disrupting that can be to someone with dementia to take them out of their setting. So it's really a neat experience to go and see them where they're at. And then my most recent position, I was the solo primary care provider. I really wanted to get back. Also, what drew me back, I'm kind of backtracking here, but what drew me to the HELPcare clinic, but I missed the collaboration with colleagues. I was doing a lot of independent work and just wondering, sometimes it's just nice to ask and have that team environment to get some what's worked well with patients they've had in this situation or on this treatment, and just getting that collaborative effort and best meeting the patient's needs. I really missed. So I've during my last couple of weeks here, I've had the opportunity to work with Danae and Kristen and Dr. Strobel, and I'm already learning just in the last 2 weeks tremendous amounts of things.
Yeah, it's kind of exciting when we think back that it was 4 years ago this month that we opened in Austin, and it was just Dr. Strobel, and it was just Dr. Strobel about a day and a half a week. But the fact that we're now up to 5 nurse practitioners, and with Karen being the fifth one to join us, but then also one PA, one physician assistant, and then another physician in addition to Dr. Strobel. So I think what she says about the collaboration is really important, because when you get 8 practitioners with different experiences, different areas of interest and focus, that really broadens what each of them is able to do, because they can bounce ideas off each other.
Well, and I can see, as Karen's describing her wonderful journey and all the things that you've learned along the way, that she's going to bring valuable insights to the team as well. And not just learning from them, but sharing her vast knowledge. That's really a great match.
So Karen, you live on a farm. Why do you live on a farm?
I always wanted to go back to the farm from a young age, and I knew that wasn't economically feasible around the Twin Cities metro area. It was just all this stuff just worked out in perfect timing with moving home and seeing, I've learned how to reframe things now to see the silver lining and the positive in things. But at the time, it was a negative experience for me. But it's actually, land prices are a little cheaper down here. And I've been able to live out and getting that hobby farm that I always wanted. I don't have quite as many animals as I did when I was a kid, because I know what it's like to have to take care of everything. And But I was actively involved in 4-H and FFA growing up and always did a lot of those livestock projects. And now it's really neat to have your own animals. And it's an healthy outlet for me when I go home at night to have them. And especially, I have Pembroke Welsh Corgis, and they're a major stress relief. They've been proven to lower blood pressure and heart rate and just stress relief. So I get to share my household with them, and they come out and help with chores at night and keeping all my other outdoor animals in line. I have horses and a goat. I had some chickens. I have a big garden, and I just enjoy being on the land and just kind of getting off the electronics at night and just going out and just
Detaching, right?
detach.
Detaching.
Right. Go home and do that at night and kind of help help me reflect on my day and change my outlook. And so I look forward to I've always wanted to go back to the farm, and here I am.
Sounds like a great combination to work where you are and to have the hobby farm at the same time.
So what do you consider some of your areas of specialty? You talked a little bit about the wound care. What are the things that you like doing the most?
Yeah, I like wound care. I've worked in surgical specialties, so I kind of know the trajectory of and that gets very broad with in terms of what they had surgery for. So kind of learning, that when I've been in those positions, it's helped me learn more about like what kind of issues were they struggling with before they had surgery and what to expect in the surgical period and post-operative period. Uh, so that not just being in the operating room. So I feel really comfortable in the pre and post-operative surgical setting and talking to patients about that. I'm an adult geriatric nurse practitioner, so I work with the adult population, older teens throughout the lifespan into the geriatrics. And I like to kind of meet the needs of my patients, and it seems that there's been an ever increasing $1 million question of how do I lose weight? And the last week or two here, the visceral fat question and having the in bodies, I've never been in a practice where I can talk to anyone beyond their height and weight and what their BMI is, but actually breaking down the components and talking about visceral fat. And I myself use a smart scale at home, so I know what is actually going on component wise in my body. So I think that's valuable insight to talk to patients about. So I really like to focus on more of the chronic disease management that the majority of our population suffers from. And I came from a lifestyle medicine practice prior to this, so I really did have the extra time, and that's invaluable to spend with them. If you're not just kind of treating them with a medication, you really have to talk about where the rubber meets the road and what kind of small steps they're going to take in habit building to change what they're doing that led to this over the however length of time, and kind of be that guide for them to get them back on track and not just looking at their numbers, their weight or their labs, but really what's going on with them. It's what I really enjoy.
Well, you're about 2 weeks into your time with HELPcare Clinic so far. What are some of the things that were attractive to you about it, and what maybe has been a surprise in these first couple weeks?
Like we talked about, like the collaboration, and I've been able to actually do it here as I learn, and more of the functional medicine, if that's the correct word. But really, there's so many other treatments out there than just medication. So the lifestyle, plus I'm learning about a lot of the supplements and having them um, resources page on our website for really third-party tested pure supplements that I can as a go-to rather than trying to recreate the wheel when I'm seeing patients. There's just been things as I'm learning here that I can easily point out to my patients, and using some of Dr. Strobel's uses these Excel spreadsheets, these charts that really help teach the patient where they're at and what I kind of look at progress, not perfection, in terms of where were they at and where are they at now. Working with him, and I'd like to use some of those in my practice here as well. So those are things I've really liked as I've started here. You also asked about what was a surprise.
Hmm.
I'm used to doing the kind of the basic lab tests and really nothing outside of that box. And I was really surprised about just learning all the lab panels that you guys do here. I've been meeting new patients. They're coming in for their first visit to establish care, and I'm kind of going through our lab panel testing, and I'm like, wow, you don't just check a TSH for thyroid function, you actually check the whole panel. And in previous positions, it's been a struggle with if they meet criteria in terms of having the diagnosis, why would you go after it and check it? So thyroid panels, the hormone testing, just having more of a complete package of care here, um, that I've not had the pleasure in other healthcare systems. I've been more constrained with, if you order that, what are you going after and who's going to pay for it?
Yeah, I think Dr. Strobel talks about it. He thinks probably about 40% of patients have a thyroid issue. And if the only thing that you run is the TSH or the thyroid stimulating hormone, and if that's in the normal range, way too often people get told, well, you're fine, you're normal, that's in the normal range. But doing that more complete lab panel on the thyroid side is just one example of how our process works, in that because we're not insurance based, we don't, and because we actually work through a group purchasing program that enables us to get good prices on these labs. And so it doesn't become this agonizing decision of, should I spend $100 on this test, or can I get reimbursed $100, or is it going to all go to the patient that they're going to have to pay for it? By doing the membership approach that we use, we can have that be all just included in the membership. And then it's something where the practitioners can have the freedom to say, does it make sense in this case that I should ask it? And it doesn't have to be, completely justified that I'm pretty sure that they've got a thyroid issue. It's like, well, let's see, because if they do have thyroid issues, being able to, respond to that, being able to have some knowledge about what should be done, is part of helping them to live a fuller life and helping them to really enjoy life, instead of being tired all the time and having dry skin and all these things that they may not have thought were related to, they just, oh, I'm just getting older. Well, it's not just getting older. You've got some issues that can actually be addressed.
Realizing that you've just been with the clinic 2 weeks, Karen, is there a patient experience in the last couple of weeks that's kind of resonated with you that shows the difference with HELPcare Clinic versus where you were before?
Yeah, on the kind of the patients here to establish care, I do hear, and I have heard prior to coming here that there's another big healthcare system in the area, and they have a hard time accessing care. So some of them might already be on an insurance plan, but they are coming here because they can't get in with that whoever that was assigned to them for primary care. And if they do, I know in my geographical area, close to the Casson Clinic, they are well established there as a patient, but they might get assigned to a provider that is just maybe there on assignment for a year, so they don't really get that relationship building and build rapport and trust with them. So I've heard that a lot with, as I'm getting to know them and they're establishing care here, because you normally wouldn't see that. You get assigned a primary care provider and that's that, but they're coming here because they want additional health benefits and insight and perspective. So I've heard that a lot with patients that are new to our clinic. And then with patients that are already established here and I'm meeting them, kind of taking over their care. It's been fun to talk about just going through and getting to know them. And a lot of them are on some supplements and they're really having benefit. It's nice to not just read about them on our website or go into a site to kind of see what they do and why people take them, but see how patients really feel on them. And it's just kind of opened my eyes to that people are having benefits, because I like to ask what they're on, why they're taking them, if it's helping them. So just to gain that insight, it helps me learn because I can't possibly have every disease or take every medication or supplement. So it helps. I learn a lot from my patients too. So I always go through and get to know them and see what not just their goals are and meet them, but with this patients that are currently established here, a lot of them have as a result of providers here thinking outside of the box and recommending different things, I like to ask them about what they're taking it for, how it's working. So that's been more surprising too.
And so, about how long are you spending with each of those patients as they come in?
I think I have up to 60 minutes for a new patient, more of a meet and greet. I do have an exam and just kind of go through their full medical history, medication list, all supplements, get to know them with their, not just their social history with substance use, but just what do they do and what's your outlet? And that's part of the lifestyle medicine part of it too, is just how do you sleep at night? What types of foods do you eat? How much activity do you get? That's valuable insight to have when you're thinking about what they're dealing with and how they best want to manage it. So I have a lot more time with new patients, and then even just the ones that come back too, more time than I would in other types of clinics.
Yeah, I mean, I
Nice.
think that's really the point with our premier membership in particular, that people are able to come kind of as many times as they need to come. And Dr. Strobel always says, well, the visit isn't over. It's just, we're just done for now. We'll see you again next time and continue that conversation. And I think that's part of the continuity that we're able to build, is that you're seeing the same practitioner time after time, and you can go deeper, in those discussions and build on that foundation. And because we limit the panel size to no more than 600 patients per practitioner, where it could be, in a hospital-based system, it could be 2 or 3,000 patients on a panel. When you have that many patients, yeah, 15-minute visit is what you have to do. But when we've got it limited as we have an opportunity to actually build those relationships, so you get to know each other.
Well, Karen, it's been so great today to hear about your history and your involvement and what special care you bring with you to the clinic there in Austin. We're just thrilled to have you on board, and I'm sure our patients are going to really enjoy interacting with you as well. So thank you for taking the time today to explain all this.
Thank you, Lee and Dan, for the opportunity. I think it's helpful to kind of see what your provider is about and what their, background is, and if you can feel comfortable with them and that sort of thing.
Yeah, thanks. Thanks for joining us today, but also more importantly, thanks for joining us at HELPcare Clinic as one of our newest practitioners. We're delighted to have you be part of the team, and it really is a great team, and we're enjoying having you be part of it. Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review, and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.